From the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. I'm Carrie Sharp. We've made it to another Monday. That means it's time for Medical Monday. And we have a topic tonight that I think a lot of people will be interested in. We're talking about rotator cuff issues. I have Dr. Kaminsky here with me with the Pinnacle Surgical Partners. Thank you for coming in, first of all.
Thank you.
It seems like everybody and their cousin has had a rotator cuff issue or a problem, some pain. So I think a lot of folks will have questions for you today. And I just want to remind you, you can go ahead and get on the line right now because I know we're going to have some calls. The number is on the screen. 615-737+ is the number to call to talk to Dr. Kaminsky. And let's just start with the big picture. Rotator cuff. What is it? Where is it? How does it work?
Well, you hear a lot of things about the rotator cuff, and what it is a series of 4 tendons about the shoulder. These are small tendons inside the shoulder joint, underneath the big muscle, the deltoid muscle, and those little tendons actually are very powerful for the shoulder. So they give you strength and power to use the arm away from your body. So reaching for objects out to the side or behind you, doing overhead activities, throwing things. Simple reaching and lifting can cause problems when the rotator cuff is damaged. So it's a series of 4 tendons, or like a sheet of tissue that encapsulates the shoulder. Again, gives you some strength of the shoulder when doing things out to the side and overhead.
We hear about this a lot with athletes, especially baseball pitchers and maybe some other athletes as well. Do you see that?
We see quite a number of athletes in all different ages and various degrees of skill level, and everything from college to high school and above. And so yes, athletes are a significant number of patients who get injured, but it's not everyone that gets injured with a rotator cuff problem. Athletes have problems with overhead throwing, which causes a lot of stress and strain on that rotator cuff. So anything that causes a lot of force on that rotator cuff, such as throwing, heavy lifting, can cause rotator cuff damage. We see everything from weightlifters, tennis players, volleyball players, athletes of all different skill levels and all different kinds.
What about the average Joe or Jane, though? Are they showing up in the office with injuries?
We certainly see a lot of patients who are not athletes in all different ages, because the rotator cuff can become damaged with simple activities, doing things around the house, lifting things in the yard or at home, weekend warriors. Even just from use and activity, you can damage these tendons. These tendons can degrade and become thin or worn over time for a number of reasons, and when that happens, that can cause pain. So rotator cuff can become completely torn, or it can become thin and damaged for a number of reasons.
So would you say that with the rotator cuff with an injury, you most likely see people who over time it kind of creeps up on them, like, oh, I had a little pain, then all of a sudden one day it was a big pain? Or is it an event that happens and it's like, I have done something to my shoulder?
Well, we see a combination of those two things. So some patients have an injury or a fall, and all of a sudden they're in a lot of pain. Some patients find that, yes, they kind of woke up, it's starting to hurt, now it doesn't go away, it disrupts their sleep at night. They tried to take medication for it, it's just not getting better, and it becomes very aggravating for the patients because it interferes with their sleep and their daily activities.
So beyond the pain, what other kind of symptoms are we talking about?
Pain is first and foremost, and oftentimes it's this deep aching pain in the shoulder. It just doesn't go away. Weakness of the shoulder can be an issue, so grabbing things out to the side and overhead, reaching and lifting things, may find that it's not quite as easy to do as using the other shoulder, the other side. Night pain, again, is very problematic, so sleeping on that shoulder can be very difficult, and some patients end up sleeping in a recliner chair, propped up in bed, or propped up with some pillows. They find they can't lie flat at night. Why that is not entirely clear, but it certainly hurts to sleep at night when you have a rotator cuff injury.
So if somebody is at home and they say, this is me, I need to find out what this is all about and what I can do about it, how do you start that process? If someone comes into your office, what happens next?
Well, we try and take a very good history. We want to know what's happened to the patient. Is it an age and activity related condition, or is it some sort of injury? So we first take a good history. We'll typically get some x-rays. The x-rays can show us a number of things. Is there arthritis in the shoulder? Are there other reasons to have shoulder pain besides just the rotator cuff? Are there bone spurs around the shoulder, which are very common to see as we progress in age? And those bone spurs can cause mechanical damage to the tissues.
And it's not always surgery to fix it, right? I mean, there are different levels of rotator cuff injuries.
Yes, in fact, the majority of our patients don't end up having surgery. We're able to treat them conservatively with a number of methods. So we'll assess the degree of injury and make a judgment of how to progress next. Oftentimes we can treat this with medication, time and rest, activity modification. Rehabilitation is an integral part of recuperating from any type of shoulder injury, so physical therapy becomes important for us. Sometimes even cortisone injections, which sound awful, but can be really helpful.
Yeah, I've had a couple of people I know that say, oh man, that was a lot of pain. I don't know which was worse, the injury pain or the cortisone shot pain, right?
They can be painful. We do them in a very specific way, and most of our patients say, you know, that didn't really hurt nearly as much as I thought it was going to. So we hear that very routinely. We have a very specific method of doing this.
What about diagnosing the severity of the injury? How do you do that? Whether it's just a sprain or it's a strain or you go to the tear?
Well, oftentimes we'll use some imaging tools, such as an MRI study, to determine more conclusively, is there a soft tissue injury that's much more mechanical in nature rather than just simply a sprain or a strain. So an MRI tool can be significant for us to determine, is there more of a tear of the rotator cuff? Does that need surgery, or can we treat this simply by rehabilitation exercises?
If you have a tear, is it always surgery, or can you live a life pain-free with a tear?
Great question. A lot of patients with rotator cuff tears, in fact the majority of patients with rotator cuff tears, we treat without surgery. And because we can do the rehabilitation, also we have to kind of remember that patients with rotator cuff tears can be asymptomatic. In other words, if we take a look at a number of people and look inside their shoulders, patients that are just walking around like you or I, they may have rotator cuff tears, but they're not symptomatic. So we have to make a judgment call of who would best benefit from any type of surgical intervention.
Well, who does best benefit?
Patients who have failed a rehabilitation program, they have failed conservative treatment, they continue to have weakness and pain, and they have mechanical damage to that tissue where it can be fixable. So the combination of, is there an injury to the shoulder? Have they tried other things short of surgery? And how much pain are they having? So if a patient is able to use the arm for daily activities, they're able to reach and lift and move the arm without much problem, we try and let them continue with their daily activities and just monitor the issue.
And I imagine it may be different whether you're a star pitcher for maybe for Vanderbilt or you're a news anchor, whether you decide what to do, right?
We do. We take into account things like handedness and vocation, recreational interest, degree of skill level in their sports activities. We take that all into account to determine what is the best treatment. So we individualize every patient's treatment depending on not just on rotator cuff tear, but also on what they do in life.
If you do send someone to physical therapy and say, I think that this can be fixed through learning, strengthening the shoulder, learning some different ways to do things, how long does that usually take before a patient says, you know what, I'm pain-free, I can live with this?
Another good question. I can't always predict that. A little bit depends on the severity of the injury. A little bit depends on the patient's interest level in getting rehabilitation also.
Yeah.
We do recommend that we do this at home, not just with physical therapy. So doing it on a daily basis, once they show you the exercises to do, becomes important. But some patients respond well just in a few weeks. Sometimes it takes a month or two. But what we want to see is progress. We want to see improvements in the symptoms, not just a status quo or a plateau of the improvements.
When we come back, I want to dive into surgery, what you do to actually fix this and what it means for the patient after surgery is done, how long of a recovery process it is. So we're going to get to that after the break, but I do want to remind you, if you have a call or a question, go ahead and give us a call. We'll line those up during the break. 615-737 plus is the number to call, 7587. All right, stay with us. We'll be right back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Cloudy skies with a few rogue raindrops, the theme across Middle Tennessee and Kentucky this afternoon. Rain will continue to increase in coverage and intensity overnight tonight, because we've got another cold front on the way. Take a look at temperatures across the southeast, fairly mild ahead of that front, but that front is expected to generate showers and storms by Tuesday morning. And behind it, some chilly temperatures, too. Here's a look at current conditions in Nashville. Wind will continue to increase ahead of this front. Gusty southerly winds between 20 and 30, gusting around 40 overnight tonight. And whatever showers and storms do come through in the morning will likely have some gusty wind with them as well. Top temperature 65 tomorrow after an overnight low of 59. Temperatures behind this front really do drop down into the 30s by Wednesday morning. Some patchy frost possible outside the city. We rebound just in time for the end of the week with more storms courtesy of another front this weekend.
Welcome back to Medical Monday. I have Dr. Sean Kaminsky here. We're talking about rotator cuff issues. It seems like everybody's had a rotator cuff problem. If you have one sitting at home right now, you're thinking, oh, my shoulder, I'm so sick of this pain, call in tonight. We'll get your questions answered. 615-737-PLUS is the number to call. We have Robert on the line. Robert, thank you for being with us. What's your question tonight?
Yes, ma'am. I'm having trouble with my right shoulder. I don't know. I can move it. I can lift it up, but it's awful painful most of the time.
And how long has this been going on for you, Robert?
I would say about 3 weeks.
3 weeks. Did you injure it in any way? Was there a fall or a lifting injury of any kind?
No, sir.
And so did you just kind of wake up with it one day and it started hurting?
Yes, sir.
And
I move it, exercises.
Uh-huh. And have you tried anything in terms of medication, or what have you done to try and help your shoulder?
I use a rub on it. I have some stuff called Emu, and I take a Tylenol.
Well, taking Tylenol, using medications like ibuprofen, rest, limitations of lifting, and sometimes things like heat and ice can be real helpful. Have you tried things like that before, Robert?
No, sir. I just use the Emu and Tylenol.
A lot of patients do find that those topical medications are of some benefit, and those are the simple things to do to try and get the shoulder better. If it's not getting better and it's worsening or it's interfering with your activities, then I think it would be time to see a physician.
Okay, I have a question.
Okay, go ahead.
I just finished my, I had a knee replacement, and I was on a walker, and I switched from a walker to a cane. That's when I think that I'm having trouble with. You think that I went to the cane too early? I should have stayed on the walker a while?
It's interesting. We see this type of problem not too infrequently. So if you're injured something else, your ankle or your knee, and then you need to be on crutches or a walker for a while, yeah, you can aggravate that shoulder. So that may be the initiation of those symptoms. Now, it can get better on its own, but sometimes it kind of persists. And if that's the case, then yes, I think you do need to come in and we can take a look to make sure that there's things that we can do to help.
That's a good question, Robert. Thank you for calling in. So go ahead. We're going to put up the number here throughout the show. So get your pen and paper ready, and then you can call Dr. Kaminsky, and we'll get you all scheduled. All right? Thank you for calling in, Robert.
Thank you.
You're welcome. I hope you start feeling better. We also have Paul on the line. Paul, what's your question tonight?
Well, I don't have a question. What I have is a comment, and I would like to comment that Dr. K actually repaired both of my rotators, and as far as I'm concerned, he's the best in the area, and I have recommended him to various people, and I hope they come to see him.
Well, that's awful nice. Hey, Paul, I got a question for you. How long did it take you to recover after surgery?
How long did it take me to recover, you think? Well, about 4.5, 5 months, I guess. It was pretty extensive.
Yeah, yeah.
I'm 70 years old. So, at the time he did it, I'm 70 years old, so.
Wow.
It took a little time, but it also had some other problems, such as some pretty advanced arthritis and things like that. But he's good. He's the best.
Well, Paul, we appreciate you calling in. Thank you very much. You take care. Keep those shoulders in good shape. 4 or 5 months when you're talking recovery after surgery. Now, Paul says, I'm 70, and that always goes into it, but is that pretty standard?
To some degree. It a little depends on the condition. So we expect improvements over time, and everyone's a little bit different depending on the degree of the injury and the associated problems, such as arthritis of the shoulder. Now, you can see improvements at 6 months or longer after a rotator cuff surgery, just because the tissue kind of knits together over longer periods of time, and you get more strength over time. So, but the first 3 or 4 months' time, that's when we really expect a lot of progressive healing.
Okay. Let's talk about that surgery. What happens if someone is actually at the point where you say, surgery's our option, we've got to do this? What does that look like?
So the surgery for rotator cuff repair is done arthroscopically, at least in my hands. In other words, I use a scope about the size of a pen. Through little holes around the shoulder, I'm able to access that shoulder joint and do a diagnostic evaluation, because we want to look for anything else that might be occurring at the same time. There could be damage to the surfaces of the joint, the ligaments, the cartilage, the biceps tendon. Remove bone spurs at that time using small little shavers, and then reattach that torn tendon. That's what the rotator cuff surgery is. That's what's called a rotator cuff repair. And that tissue is reattached using small little anchors and sutures inside the shoulder in a very technical or specific fashion. That way we can enhance the healing to the best a degree possible.
When you talk about sutures and repairs, it sounds like a construction site in there when you go in there.
It's a fascinating procedure. It usually takes us about 40 minutes to perform.
Oh, wow.
But we do this very quickly and very efficiently, and we have a very significant established system of how to address these. But every shoulder is a little bit different. Every rotator cuff has to be repaired just a little bit different, and that way we want to make sure that the healing process goes as uneventful as possible.
So how often do you find other issues in the shoulder once you get in there?
It's fairly common to find other issues. Like I mentioned, we get MRI studies, which is the best non-invasive test to look inside the shoulder joint, but we end up finding all sorts of surprises, I guess we can say, inside the shoulder. In other words, ligament or cartilage tears, biceps injuries, other things that need to be addressed to try and rehabilitate the shoulder again as much as possible.
And what kind of, you mentioned the bone spurs, you can go in and work on those. What about other issues? What can you do?
Well, if there's, for instance, tearing of the cartilage around the socket called the labrum, we'll either repair that or remove the torn pieces inside the shoulder joint. Sometimes there's a loose piece floating around inside the shoulder, so we'll remove that. If there are arthritic surfaces inside the shoulder joint, the ball and socket have worn down and become rough and irregular, I'll take small little shavers and smooth that off, and that oftentimes gives patients some pain relief, substantial pain relief.
So when somebody comes out of surgery, we've heard some surgery people are like, whew, I feel better, fantastic. When someone comes out of this kind of surgery, how are they feeling?
The first few days is typically the roughest.
Yeah.
So we typically recommend some simple things to help our patients, getting propped up in the recliner chair, propped up in bed. We use special cold therapy units to try and keep the swelling down and keep the pain in minimum. We have them take the pain medication pretty routinely. We do a number of things to try and minimize that pain both beforehand and afterwards.
And how long is a patient in a sling?
It depends on the procedure, but we typically ask the patient to use the sling for the first 3 or 4 weeks' time. That's partly as a reminder to themselves not to do too much. It's partly as a reminder to other people not to grab their arm, shake their hand, or aggravate the patient's shoulder.
And then the physical therapy also comes in.
We do institute therapy. We're more aggressive about doing therapy, at least in my clinic, because we're more assured of the type of repairs that we get. So we begin therapy fairly quickly afterwards, and that's tough for the patients to start, but patients find that it doesn't really hurt nearly as much as they thought it was going to. We very gradually get the mobility, then work on strength, and then work on more aggressive exercises.
Okay. I've been through shoulder surgery. It's hard to say shoulder surgery. I'm sure you say it 100 times a day. But whoo, that physical therapy, mercy. But it did help. And I told you, I'm back. The shoulder's probably better than my other shoulder now that it's been repaired. So again, if you have a question tonight about rotator cuff injuries, go ahead and give us a call. The lines are open. 615-737+ is the number to call. Now, it doesn't. A rotator cuff injury does not always lead to surgery. In fact, you said it often does not, right? There are other means to take care of these injuries.
That's very true. The vast majority of our patients that we see in the office don't need shoulder surgery. So, and maybe some patients think that as soon as they have an injury to their shoulder, they're scared about coming into the office because they're going to be told they may need surgery and they want to avoid that. Well, I would encourage those patients to reconsider because it's terrible to live with this shoulder pain. It really is a problem with life's activities, and anyone who has shoulder pain can sympathize with that, as you probably know.
You don't want to reach out, and every time you reach out to grab something, you're like, oh, I shouldn't have done that.
Exactly. So again, there's a number of non-operative treatments that we can provide that seems to really help everything between certain types of rehabilitation programs to different types of injections. There's even other types of newer injections called stem cell injections and platelet-rich plasma, PRP injections. Those are indicated in certain circumstances or certain patients. Those are more biologic ways to try and rehabilitate the shoulder. So really we have a few things at our disposal to try and help patients who have pain without having shoulder surgery. And again, the vast majority do not need shoulder surgery.
So tell me about these injections. That's interesting. You said they're new, so people may not have heard of those. So let's start with the stem cells.
These are much newer treatments, and they're not typically covered by insurance. They're not typically proven treatments for the shoulder, but they're very exciting treatments to have available for us. And these stem cells are undifferentiated cells that we inject around the shoulder in certain areas or for certain conditions, and we think they can enhance the healing process for different types of conditions, rotator cuff injuries, arthritis of the shoulder. And we see this particularly in the athlete population who wants the quickest way to try and return back to sport without having surgery. And sometimes it works really well. Not always. Sometimes it works less well.
And how quickly are you seeing results from it? Some from saying this did work, or nope, we got to try something else.
Well, we usually try and see results within the first month or two's time. So we want to see maybe not resolution of the symptoms, but we want to see improvements of that pain. And so sometimes we'll do more than one. Sometimes it's a multi-injection process. We have different options for that. Sometimes we spin the patient's own blood down and take what we call the platelet-rich coat there and re-inject that back into the patient's anatomy, into the shoulder, to try and stimulate some healing response that may not have occurred thus far.
Oh, that's really interesting.
They're very, very newer treatments, and they've been around for some time, but they're not wholly proven treatments yet. So we're very judicious in who we use and how we use those treatments. We've seen some great results and some not so great results. So we try and find just the right patient to use those for.
I'm sure you have to tell the patient, we're going to go into this eyes wide open. It may work, it may not. We aren't really sure yet, right?
That's correct. They're fascinating treatments, and it's more of a biologic way to try and rehabilitate the patients and improve their pain. We're still in the learning phase about these treatments, and we're involved in different trials about how these might work, and those big trials are just coming to pass, and we'll see what kind of response we get, what kind of improvements we see.
When you have a patient who actually needs surgery, anytime you have surgery and open up the body, things can go wrong. This is a very common surgery, but what can go wrong?
There's a number of complications that can occur with shoulder surgery, and that's what brings patients. A lot of what I see in our office are patients that have had prior shoulder surgery and done elsewhere and still have continued pain, and it's a problem. So about a third of our patients who we treat surgically have had surgery done elsewhere. And so it's a big problem, and patients that I'm sure are watching this can attest to that problem. They've had shoulder surgery, they're not quite right, they're still having some pain, and there's a whole host of reasons for that. But complications, the number one I think that we see is not healing of that rotator cuff tissue and having continued pain, so failure of that procedure.
Is it just because things did not get reattached right, or what's the problem? Are people trying to get back into their routine too early?
Well, I think there's definitely a host of reasons, both technical and biologic. There's patient-dependent factors. There's a number of things that can occur. Sometimes the implants themselves don't work very well. Sometimes there's technical reasons, which I think we could have done things differently at certain times. And it sounds easy to just pull the tissue back and let's reattach it with some sutures and screws, but it's a little more complex than that.
Well, I'm sure that's why you go to school for so long. Let's talk about other issues of the shoulder. People may come in and say, oh, it's a rotator cuff, it's torn, I need surgery. But there are other issues that can be there, like tendonitis, an impingement, a frozen shoulder. What does all that mean?
We see those very commonly in the office, and patients do believe that rotator cuff injury is the first on their mind, and that's what they come in for. They're concerned that may be a rotator cuff tear, and I agree that we see patients with what we call frozen shoulder or adhesive capsulitis.
So what is that?
It's a very common condition. It causes stiffness about the shoulder. So the tissue around the shoulder is normally loose and pliable, allows the shoulder to move in all different degrees. What happens is that normal architecture is replaced by scar-like tissue that kind of constricts and limits the shoulder motion. And when that happens, that tissue becomes very painful inside the shoulder. So patients will realize they can't reach behind their back. Men have difficulty getting their belt loop or their wallet behind their back, can't reach out to the side. So stiffness and pain are the hallmark of this condition.
So what do you do?
Well, rehabilitation is our #1 treatment for that.
Oh, wow.
The majority of our patients can recover from that type of problem. And again, this condition is much more probable and common in patients with diabetes. About 20% of patients with diabetes will have this condition called frozen shoulder. So if you have a shoulder that's painful and you're diabetic, then we need to look for that. And in fact, 2% of the general population will develop adhesive capsulitis or frozen shoulder in their lifetime. Very common problem, as you
and you're telling me
to.
Through rehab, you can loosen all that back up and get that shoulder working again.
Well, we try.
Yeah.
We can't always predict who is going to be a successful candidate for rehabilitation of the shoulder through physical therapy. But we don't always know who is going to be that best candidate. So we send most of our patients to physical therapy to try and stretch that shoulder out, because as that motion improves in that shoulder, that pain typically gets better.
Okay, well that is good news. Okay, when we come back, we're going to be talking about tendonitis as well. I imagine a lot of people come in and really have that. So when we come back, we'll do that. And of course, we're taking your calls. So if you have one, give us a ring. We'll be right back.
We're keeping us with the all-new Franklin Kia this month by offering no money down on all new Kias in stock, like a 2017 Kia Forte. No money down, $199 a month. Or how about a brand new Kia Optima? No money down. Redesigned 2017 Sportage? No money down. Brand new Sorento? You guessed it, no money down. Come to the all-new Franklin Kia with payments starting at just $199 a month. That includes your tax, your tag, your title, all the fees, and best of all, it's not a lease. You own it.
Franklin Kia, keeping it awesome.
Welcome back to Medical Monday. We are talking about rotator cuff issues. So if you have some shoulder pain, go ahead and give us a call. 615-737-PLUS is the number to call. Dr. Sean Kaminsky is here with the Pinnacle Surgical Partners. Where are you guys located?
Summit Hospital in Hermitage, Tennessee.
Okay, I should be able to tell right there from your scrubs, right?
That's true, yes.
How many surgeries do you end up doing a day or a week? What do you think?
It just varies. Tomorrow we have 8 shoulder surgeries to do.
Oh, wow. You're going to be busy tomorrow. So
tomorrow we'll be busy.
You need a good night's rest, huh? We need to get through these phone calls.
So my patients always ask. That's correct, yes.
That's true. I don't fault him for asking that. Now, not everything is a rotator cuff tear, which sounds pretty scary. You're assuring me that the surgery has come a long way and folks can manage through it. It's not too bad. But let's talk about tendinitis in the shoulder. Is that kind of like having tennis elbow, but in the shoulder? Similar.
It's oftentimes an overuse injury, just like tendinitis of the elbow is. So we find that patients who just reach and lift and use the arm for daily activities, and oftentimes their work activities can be contributory towards that. So patients who do outdoor work or factory work, or even patients who are lifting items at work on a daily basis, find that their shoulder starts to hurt and becomes painful, and that's when we call this bursitis or tendinitis. They may not have a frank tear of the tissue, but it sure hurts for the patients. Yeah, and you don't want to be taking ibuprofen for the rest of your life. So what do you do? Well, it's easier said than done, but short-term rest is helpful. Limiting the lifting and activity, trying to use the other arm, or lifting more at the waist level without reaching overhead and reaching out to the side is sometimes beneficial. If those things don't work and the pain doesn't get better, it's time to see your doctor. Okay, and then what do you do? Well, we'll do a full evaluation to make sure that's what we're dealing with. So impingement refers to this mechanical compression of the rotator cuff, so just reaching and lifting out to the side can compress against bone spurs or thickened ligament tissue, and that's what we call impingement syndrome. So what we try and do is, besides minimize those type of irritation, get the patient to some rehabilitation. Oftentimes, again, a cortisone injection, which really just helps reduce inflammation, is helpful in treating this. And sometimes that combination of things is really critical to getting the patient better. When it comes to dealing with these things like tendinitis or impingement, how long are we talking about? I know you told me it's hard to tell because everybody's different, but a lot of people say, when am I going to be out of pain, doc? Right? Oftentimes it depends a little bit on the severity of the symptoms initially. Some patients really have terrible pain. They, really interferes with what they're doing in life. And those patients may take a little bit longer, but we hope to see improvements within 4 weeks' time typically. I know there are people out there watching who say, I've had shoulder pain for years, but they don't want to go to the doctor. Is this something where you wait, I guess treatment becomes harder to do, or no? Not necessarily. If a patient can tolerate the symptoms, say, I'm going to live with this and put up with this and, tough it out, those patients are certainly welcome to do so. But if it kind of pushes over that line, now it becomes, it's problematic with certain activities too. Now it's interfering with lots of my activities. It hurts more often. The pain's getting worse. The intensity's getting worse. It's more constant or more frequent. Then I think it would behoove that patient to come in and see us, because again, there's things without surgery that we can do to help. You were telling me that the rotator cuff is 4 small tendons. That's what it's made of. So why is something so small causing such big problems? We don't always know why it causes such pain, and the pain isn't really right. Patients will find that hurts into the deep muscle of the shoulder, and that's a sign that there's problems inside the shoulder joint, because it gets referred to that muscle or even down the arm into the biceps region or the upper arm. So it doesn't have to be a focal area of pain in the top of the shoulder. It could be deep inside and kind of goes down the arm sometimes too. So you have to be a bit of a detective to figure out what's really going wrong. I think it's an excellent comment, because not all shoulder pain comes from the shoulder. There's other things that can cause shoulder pain too, and we have to be aware of those issues, because there can be one or more than one causes for shoulder pain. We have another caller I want to get right to. Robert is on the line. Robert, good evening.
Good evening to both of you.
What's your question tonight?
It's funny, just what he was mentioning right now is what's going on. Now, I'm seeing an orthopedic for a slight fall that I had. I recently had a triple bypass, kind of weak. You know, I didn't make it to the couch the right way, and the shoulder went like behind the arm as I fell into the couch.
That sounds terrible.
And, my therapist is telling me, well, you got an impingement based on how I told him where the pain was, like from the rotator cuff area down the, down the back of the arm to the elbow. Severe pain. So far, I've been given 2 cortisone shots. I can't move my right arm. Like if I wanted to wash my left shoulder, I can't do that without excruciating pain. Now, here's a real brief history. I'll be fast. In 90 actually, I was in a head-on car collision, and the way I landed into the giant steering wheel of a 1980 Ford Mustang, it crushed my collarbone. I didn't get that fixed or operated on in 2004 and found out through an MRI that there was more damage than just a collarbone being crushed. So I'm wondering, and my orthopedic won't give me this answer, he's playing the 10-care game, which is 2 cortisone shots, then we could submit an MRI. But the actual surgery in 2004, the doc said I was lucky to be able to put your, rotator cuff area in your collarbone back together again. He said, don't ever damage it again because you probably won't be able to go through another round of surgery to repair it. Does impingement sound like what I did if the cortisone shots aren't working?
Okay, go ahead and hang up and listen to your TV, and we'll get this answered.
It's certainly possible he has that mechanical irritation or impingement, but it certainly also sounds like there may be something more going on for him. He has that history of old injury, had previous surgery and damage to his shoulder. There could be things there that may have been a little bit more on the fragile side and then may have been really aggravated by this fall.
So what do you do then? I mean, is this a candidate? I mean, I know this is a specific case and you're going to have to see tests and MRIs, but on someone who has had surgeries in the past and had such injuries in the past, do you go back and do surgery, or they're kind of like, this is not a good idea?
Well, again, a lot of what I do is revision shoulder surgery, and we've kind of created an algorithm or checklist for things that can be problematic in patients who have had previous surgery. And if we go through that checklist and kind of go one by one, oftentimes we can recuperate the patient's shoulder, get them back to normal shoulder health.
Wow.
Not every patient, but most patients are really pleased with the results of our revision shoulder procedure. In his case, we'd have to, like you said, take a look. There may be some other damage there, but there are things that potentially can be done, and I would encourage him to express his concerns to his physician and see what else can be done, and imaging studies may be the next step for this gentleman.
On an MRI, can you see pretty clearly what's going on in the shoulder, or does it take, putting a little camera in there to really dig around and see?
MRI studies are a great test. They're not perfect tests, and the MRI studies can become in different flavors, essentially. So we can get an MRI study where you go into the tube and it takes these pictures, and hopefully you're not claustrophobic when you go in. And then there's also something called an MRI arthrogram, where actually the radiologist puts dye inside your shoulder joint. And we frequently use Premier Radiology to help us with this type of procedure, where they actually put dye inside the shoulder in a very specific way, then get the MRI study. We see really good pictures that way and give us some enhanced imaging of the rotator cuff and other structures inside the shoulder.
Okay, so there is hope for Robert. And by the way, I mentioned we are going to show the number to call to get a hold of Dr. Kaminsky, and we're going to do that. So get your pen and paper ready, and we will show that hopefully going into this next break if we can get that queued up, but we will show it before the hour ends. So stand by for that. We also have Grace on the line. Grace, good evening. What's your question?
Hi, I just had a quick question. Okay. I had rotator cuff surgery about a year ago, and I'm just still kind of experiencing moderate amount of pain. Do I need to consider having a second surgery, or is this just going to be pain that I need to deal with the rest of my life?
Good question.
Yes, and we hear that a lot too. Patients who said they were told nothing can be done, they have continued pain, and a lot of patients try and just live with it and put up with it if that's what they're told to do. And when we try and rehabilitate and recuperate from a revision procedure, they realize they don't have to live in that pain. Oh. So my recommendation strongly would be, let's take a look, let's see what's going on here, and let's go down that checklist and see what kind of problems we can address.
So that's a red flag when someone says, I had this a year ago and I'm still in pain.
A year is plenty of time to recuperate and recover from this. And if the pain is still present with life's activities, that's a problem. That needs to be addressed.
Well, that's clear as day then, black and white. Grace, you need to give them a call. We hope you feel better, Grace. Thank you for calling in. You know, that's terrible when you take the time off from your life to have this surgery. You go through all the rehab and you're still in pain. How frustrating.
Very frustrating, because it, as you alluded to, it takes so much time out of your life. You have to miss work for several weeks duration. You go back to your work or your job activities with limited use of the arm. You're in your brace. You're going to therapy a couple of times a week for typically several months' time. It's a big procedure, and it takes a lot out of our patient's lifetime, so we understand that. We sympathize with that, and we try and maximize what we can do with our patient's time and efforts. And
not to mention just trying to figure out how to do life in that sling for so many weeks.
Yes.
Oh, talk about frustrating, but it can be worth it in the long run.
Yeah, patients will forget. They'll try and reach and lift something with their arm in the sling, and it'll be a reminder. But our goal, hopefully, this will be successful. This will be worth it at the end. And thankfully, we have a lot of happy patients in our practice.
That is good. We heard from one already today.
Two
surgeries. That's
two, yes. I know.
Okay, we're going to take another quick break. If you have a phone call, if you have a question, go ahead and give us a call, 615-737+. We have a couple lines open. We'd love to get your call lined up. Stay with us.
I can read up close. I can see my phone. I can see objects I didn't even realize were there.
Be your best with Talk of the Town.
Loden Vision Centers has been around since the late 1960s. My father was an ophthalmologist, been working at his office ever since I was a child. It's hard to believe, 19 years of private practice already.
I had astigmatism, I was farsighted, I was having to, everything had to be, bright, large print for me to see.
The extended depth of focus lens, known as the Symphony, elongates the focus point. Traditionally, we've just had to use either one focus lens implants that would just give one plane of vision, or a multifocal lens that would give distance in near vision, but wouldn't give very good computer intermediate vision. The lens is approved for cataract patients. The unique thing about this Symphony lens is that it comes with astigmatism correction.
It fixed everything with one surgery. I didn't have to have any other astigmatisms, no reading glasses.
So what we see was patients being able to drive at night without glasses, read the dashboard of their car, very good reading vision on a computer. Women love it. They can put their makeup on without having to use special makeup mirrors.
If you've been waiting for this, and you have astigmatism like I did, the Symphony lens is the one for you, because I can tell you I couldn't see 10 feet without my glasses, and now I can see 20 feet without them, and it's like being free.
Welcome back to Medical Monday. Here we are talking about shoulder injuries all over the place. That's what you do day in, day out. I have Dr. Sean Kaminsky here from Pinnacle Surgical Partners. That's his job, dealing with shoulders. And we are talking about the injuries to the rotator cuff. If you have a question, if you say, I don't know, maybe this is what I'm dealing with, go ahead and give us a call. We've had a lot of great questions already. And we have another person on the line. We have Walter on the line tonight. Walter, go ahead with your question.
I have a question. Like, sometimes my work and stuff, like my elbow be like in a pain, but I got like hyper extended for actually to pop to make the pain go away, or like sometimes I walk or my knee does the same thing, like it always popping. Is there a reason for that?
Well, I'm glad you brought up popping sensation, because we see that in the office a lot, and patients are worried, does popping inside the shoulder joint problematic? Well, popping itself is not too uncommon for the shoulder. Some patients just develop popping sensation for whatever reason. Now, if popping sensation is associated with pain, that's a different problem. That's when you should see somebody, because popping can be due to mechanical irritation inside the shoulder, whether or not it's inflammation around the bursa, which is the tissue on top of the rotator cuff. The biceps tendon can snap back and forth around the shoulder joint. There could be things inside the shoulder joint that can mechanically catch. Loose pieces can float around inside. So there's a number of reasons why popping can occur. Fortunately, most of those reasons are normal.
Really? That is good to hear. But if it comes with pain, that's when you're saying something's not right.
That's when I would recommend further evaluation.
Walter, do you have some pain with that popping?
Not really, like always, like when I got like hyperextended for it to make it actually pop, for it like to like go away.
Yeah. Well, wish you the best there with that.
Yeah, I would certainly be patient with that type of problem, and it's only with hyperextension. If it's painful to do that, then certainly we can take a look and get a better evaluation. Now, some patients with hyperextension do develop things like dislocation or instability, which we see a lot in the office too. So everything from water skiing and sliding into second base, we see these injuries happen very frequently. A lot of dislocations can be treated without surgery, fortunately, depending on someone's age and activity level, but we do see that also very frequently.
I had a dislocation. We talked about that before the show, and it was terrible, but I'm better now, so that's the good thing. I pity the person who has a dislocated shoulder. Okay, let's jump back to line. We have Lloyd on the line. Lloyd, thank you for calling in tonight.
No, thank you.
What's your question?
Oh, I just called already.
Oh. Say again?
And I didn't have a question.
Oh, okay. Well, very good. Well, thank you for calling in tonight. Thank you for watching. You take care, okay? We're going to go to Marie. Marie, thank you for calling in. What's your question?
I have a problem, a pain in my arm. It's not my shoulder, but it's not my elbow. It's right in between. And I can't lift my arm up real high because it goes to give me pain. And I can't let it down, right down, it pops and it hurts. And I don't understand, what's making it hurt. And this is why I roll cigarettes with my right hand all the time. And I don't understand why it hurts.
Okay, let's see if the doctor has any thoughts.
Okay.
Well, where in your arm does it hurt? You said lower down in your arm between your shoulder and your elbow?
Yes, it's right in between it that it hurts.
And in the front? Or
I can't raise it. I can't lift it. I can't lift it real high. And when I lift it out, it hurts. And when I lift it up, it hurts.
And how long has that been going on for you?
It's been, I guess, a couple of weeks, but it's just getting worse now, and it's just sobbing pain constantly. I've been taking ibuprofen, but it just hurts so bad. I can't hardly, like I said, I can't hardly raise it up or lift it out. It hurts so bad.
Yeah, in this case, if you're hurting this much, I think medical attention would be appropriate for you. You tried some rest, you tried some medication, it's not working, and difficulty with reaching and lifting, that could be suspicious for a rotator cuff injury. And again, there's things that we can do that, short of surgery, that may be helpful, but I hate to see you in so much pain, and I think an evaluation would be beneficial, would be helpful for you.
All right, Marie, stick around for that number. We're going to give it out here pretty soon. Let's also go to Richard here. He has a question for us tonight. Richard, what's your question? Thanks for being with us.
Yes, thank you for taking my call.
You're welcome.
Doctor, in the late 60s, I had an accident, and my shoulder, threw my shoulder out of place. And it was later in the 70s before I ever had that fixed. And I just wondered if waiting so long caused this problem that I had later with my rotator cuff. I had to have shoulder reversal surgery.
Yeah,
I don't have any pain now.
That's a big procedure. He's alluding to a specific type of shoulder replacement called the reverse shoulder replacement.
Oh, wow.
And that's where we put the ball on the socket side, and the socket's on the ball side. And so it's hence the name reverse, but it helps to compensate for loss of the rotator cuff function. And so we use that in patients such as this gentleman who have arthritis of the shoulder and loss of the rotator cuff function. So instead of repairing the rotator cuff, which in this circumstance can't be done, we have to find other ways to compensate for that injury. So he's had a chronic injury, a rotator cuff that's not repairable, and ends up having shoulder replacement surgery. I hope it's successful for you. I hope it's doing well for you.
Oh, I haven't had any pain at all. It was done in 2010.
That's fantastic.
A lot of our patients do quite well from that procedure with those type of conditions. It's very specific and narrow conditions, but they seem to do quite well.
Very cool. Richard, thank you for calling in and sharing your story. Now let's get to Lloyd. Lloyd, I apologize for that earlier. Go ahead with your question.
You ready for me?
Yes, sir, we are. Go ahead.
Okay. I injured my shoulder in a fall, Christmas Eve. I went and the shoulder became just completely useless. I saw a doctor. We went through therapy, and the use of the shoulder has come back almost back to normal, except like when I pick up a jug of milk and want to put it back into the refrigerator, I have trouble lifting the jug up and pushing it into the refrigerator. That's the only problem I have with the shoulder now. Is that apt to improve, or?
Well, it's been a few months now, so it's been a little over 2 months' time since your injury, and you're coming along quite well. You may have damaged your rotator cuff, But as we mentioned before, not everyone needs shoulder surgery, and that type of problem may or may not improve. You may still have some weakness of your shoulder or some pain if there is a rotator cuff injury.
Yeah.
So if you feel like you're continuing with day-to-day activities and you can reach and lift without much difficulty, you can continue to watch it over more time. If you find that that's a real problem for you, then I think further evaluation is going to be needed, like an MRI study, to determine the extent of the rotator cuff damage to your shoulder.
Well, I'm doing everything I usually do with that shoulder except for that one problem.
Mm-hmm.
And that really can stress the rotator cuff, so you can see where that comes into play. But if you're functioning very well, that's what it sounds like here, then I wouldn't be in any rush to shoulder surgery or any further treatment besides wait and more time.
Okay, doctor, I appreciate it.
Hey, thank you for calling in. We really appreciate hearing from you tonight. I have a question. We've had a couple of callers that I had surgery a long time ago on my rotator cuff or a different surgery. Have things changed substantially with shoulder surgery in the last 20, 30 years that sometimes you have to say, okay, well, you had that surgery, but things have changed and we can do it better now?
We see a lot of differences just in the last number of years, improvements in technology, improvements in how we do this procedure, much more minimally invasive, and that's what we specialize in, trying to treat patients without big scars. We do these procedures very quickly, very efficiently, and try and minimize the damage to the surrounding muscles in the shoulder, and that's really helps patients recover much more quickly.
Can a rotator repair wear out over a couple of decades?
Tissues can wear down as we age and progress over time. The good news is once that rotator cuff repair heals, and if it does heal, most patients do really quite well over the course of time. So if it heals well, usually that kind of lasts hopefully a lifetime.
What if somebody is sitting at home and saying, I do not want to be in this boat, or they have a family member who has gone through rotator cuff surgery or had an injury and had to go through rehab, and they know they don't want to do it? How do you prevent these sorts of injuries?
Prevention can be difficult depending on the type of activity that you choose, but patients will find that if certain activities are problematic, then limiting those lifting activities, using the arm more at the waist level instead of reaching out to the side. Sometimes some gentle physical therapy exercises or even exercises at the gym or the Y can be beneficial. So overall conditioning of the body, using muscles not only in the rotator cuff but the muscles around the shoulder to strengthen, the scapular or shoulder blade muscles, the deltoid muscles, they can all help kind of maintain the function of the shoulder and avoid having pain.
Is there any exercise that people do at the gym that you say, never do that exercise because it's bad for your shoulder?
I don't. I love patients who exercise because I think it's great, but we try and kind of tweak their program if they find that they're having pain. So we try and do some cross training, so avoid stress on the shoulder with certain exercises, and some of those things include really, this is for our kind of our weightlifting patients, heavy bench press, heavy reaching military press, things that require really, really heavy weight repetitively. So you can do some of those, but we recommend that we cross-train, try and modify the amount of weight, and for certain patients we change their grip and we change their way they're doing the exercises, correct their form, try and get them back doing what they want to do.
Very good. Okay, on that note, we're going to wrap things up. We'll be back in just a moment with some final thoughts. Stick with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Cloudy skies with a few rogue raindrops, the theme across Middle Tennessee and Kentucky this afternoon. Rain will continue to increase in coverage and intensity overnight tonight because we've got another cold front on the way. Take a look at temperatures across the southeast, fairly mild ahead of that front, but that front is expected to generate showers and storms by Tuesday morning. And behind it, some chilly temperatures, too. Here's a look at current conditions in Nashville. Wind will continue to increase ahead of this front. Gusty southerly winds between 20 and 30, gusting around 40 overnight tonight. And whatever showers and storms do come through in the morning, will likely have some gusty wind with them as well. Top temperature 65 tomorrow after an overnight low of 59. Temperatures behind this front really do drop down into the 30s by Wednesday morning. Some patchy frost possible outside the city. We rebound just in time for the end of the week with more storms courtesy of another front this weekend.
Thank you for joining us on Medical Monday. Today we are talking about rotator cuff issues, and if you are in this pain, I am so sorry, but there is help out there. Dr. Sean Kaminsky has been our guest with the Pinnacle Surgical Partners. Again, thank you for coming in, and I just want to go back over just the big picture of what is the rotator cuff, because everyone kind of throws it out there. Oh, I've got an injury, I've got a tear, I need surgery. What is it?
So there's a number of structures inside the shoulder joint. The rotator cuff are the series of those tendons around the shoulder that can give you power and strength of the arm. There's other structures inside the shoulder joint like ligaments, tendons of different kind, the biceps, the surfaces of the shoulder. All these can be damaged or injured in some way. So if you have shoulder pain, sometimes it's these other things, and we can address those other things. There are things called slap tears, which people hear about frequently, called the superior labral tear. Other things that can be problematic in the shoulder that we can address either with or without surgery.
We've had a number of people call, and it's been advised that you need to go see a doctor. If someone is coming in as a new patient, what can they expect?
Well, what they expect is a good diagnosis. They want to see the physician take a good history to make sure we know what's going on with the patient. X-rays will typically be taken to make sure that there's not types of bone spurs or arthritis inside the shoulder joint. Physical examination will be important, so we want to determine, is there weakness of that shoulder, and then we'll try and isolate those rotator cuff tendons to determine which, if any, are involved. So we'll do an assessment and we'll make a plan for that patient. Oftentimes that plan includes just rehabilitation, maybe medication, sometimes even a cortisone injection, different types of treatment that are typically non-operative in nature.
And you are located in Hermitage.
We are located at Summit Hospital in Hermitage.
And again, the name of your practice?
Pinnacle Surgical Partners. We work with Advanced Health Partners, and it's under my name, Dr. Sean Kaminsky.
Okay, if you need to get a hold of the doctor, go ahead and give us a call. The number is 615, it's on the screen, 986-6033. They're going to direct you to Dr. Kaminsky if you give that number a call, and then you can get set up with his office. Also go to Medical Mondays at ouradvancedhealth.com, and you will get routed to the right person to get your pain taken care of. Thank you so much for coming in.
Thank you.
We appreciate your knowledge and advice and guidance to all of our callers. And thank you for watching tonight. You have a great day.